Unique New York. All right, here we go. We are live with Mike Piekarski, Dr. Mike Piekarski, OCS, orthopedic clinical specialist, certified specialist. What's the C?
Yeah.
I forget.
OCS, clinical specialist.
Clinical specialist. Yep.
Yeah.
So, Dr. Kickass, for those of you who don't know. And why don't we jump right into it and tell us where that name comes from?
It actually kind of came as a joke when I started doing Instagram. I was like, I wanted something catchy, and I didn't think it was going to grow the way it did. And I was like, I had just got my doctorate when I came up with the idea. Obviously, I do mixed martial arts, so I was like, well, I'm a doctor who kicks ass. But again, it was like kind of like a joke at first, and then my brand started to grow. But then it became very unique. So I was like, At one point I thought about, do I want to change it to be like have like a little bit more credibility? But enough credible people still valued what I said. They valued the content, so I just stuck with it and embraced the unique name.
Love it, man. Love it. Yeah, it definitely stood out when and just for folks, quick shout out to one of my former guests, Frank Benedetto.
Nice.
He connected us, and I asked him a question because I know he's in the MMA space as well. So I was like, hey, do you know anything about ACL return to sport? Because someone else had asked me about that. And he connected me to Dr. Kickass, and I'm like, oh, okay. Yeah. Okay, cool. So that worked well. And here we are. We had a bunch of scheduling issues as well. So here we are. After a few weeks, I guess you have limited in between patient admin time. So I appreciate that we stuck with it. And I think this was our 5th Wednesday in a row that
I think so. We made it work.
Like that. Yeah. So here we are right before the holidays, and you're up in Sacramento. I'm actually visiting friends down here in Hermosa Beach. That's we're in the same state. Maybe we needed to wait to be in the same state for all that. And so here we are. And coming back to it. So Dr. Kickass, you work with MMA athletes. Tell us a little bit about how that clinical setup is, or is there anything that folks should specifically know about if they're in the MMA space or BJJ? However, a friend of mine does it. We always joke that it's a little funny to say BJJ. So anything that the athletes, let's talk first to the athletes in those sports, any version of martial arts or mixed martial arts. Or Brazilian Jiu-Jitsu. So what should the athlete know from the physical therapist who specializes in that?
I think, you can take this to any athlete, but I think it's a good idea if you are an athlete to work with, a medical team who understands what your goal is. So, it's pretty common that you go see a medical professional. You're like, oh, I hurt my knee, my elbow. How did it happen? I'm doing martial arts. I'm doing this sport. Oh, maybe it's time for you to stop that. Well, that's like a really lazy answer, right? That's pretty much saying the person will get better, but they're going to do the sport, right? So I think it's good for any athlete to work with someone who understands what you have to get back to. I think that combat sports, Brazilian Jiu-Jitsu, wrestling, boxing, Muay Thai, they're unique because a lot of traditional sports like field sports, whether it's basketball, whether it's soccer, they have a lot of similarities, right? Like if you think about it, most field sports, the goal is you have an object, whether it's a ball, a puck, and you have to get it into a goal, whether you're dribbling it, whether you're kicking it, or it's hockey, you know what I mean? But they're all very similar. And there is different demands, obviously, based on whether you're playing on a field or ice. But I feel that combat sport is very different. And it's very common for me to talk to an athlete saying, oh, I used to work with someone, physical therapist, but they had no concept what I was trying to get back to do, right? So I think that kind of helps because from there, let's say someone has, an injury. It's like, well, when is it appropriate to get back? And then from if you dive in deeper, in that meantime, what can you be doing, right? So it's like, don't do anything. What if you can do, so from the jiu-jitsu standpoint, maybe someone could do some technical drilling, right? Where it's it's not competitive, it's skill building, but it's in a slow, safe manner. Maybe it's appropriate for someone to do what's called flow rolling, which would be they're moving it. So there's that unpredictable element, but it's not competitive. So they're not going to get hurt again. So there's levels to it, how to get get someone back. So I think it is important that you work with someone who understands that, number one, and then two, like when you work with them, how do you get back, and then how can you try to minimize from this happening again, right? Because I think that's common for most athletes is they get hurt. Like most people, so you don't go to the car mechanic until your car breaks down. Well, what if you could do something so your car doesn't break down, right? I think that's pretty common for athletes too. A lot of athletes get it. I think what hurts the combat athlete is because it's still a relatively new sport. There's not a lot of money in it. Like in like the Brazilian Jiu-Jitsu world, there's like, I mean, for the most part, there's no money. I mean, like the top, 0.1% might get money, but for the most part, it's a recreational sport. Like if you're a Brazilian Jiu-Jitsu world champion, you still had to pay to go to the tournament, which is crazy.
Yeah.
Yeah. When it comes to mixed martial arts, now that's starting to grow. You can make some money on that. But even then, like I would say for the most part, most professional fighters that I know, whether in the UFC or not, don't have health insurance. They pretty much, they rely on, I'm going to get hurt in the fight. And then from there, they can use the medical insurance that's provided from the event. So, it's their jiu-jitsu people, MMA people are pretty common to just kind of ignore injuries. And then, if you think about it, that's kind of like what ends a career is you accumulate all these little nagging chronic injuries. And at some point, your ability to train is hampered too much. So if you can't train, you can't compete.
Right. Yeah, that definitely is an underlying theme with almost every sport. But I want to be I'll be semi-controversial here, and you can obviously tell me to take it the other direction if it doesn't fit. But I think for talking about combat sports, again, the uniqueness of it is you're directly one-on-one with someone in front of you, like football, like a lot of these other sports where, you can't necessarily control what's about to happen. So I guess my question that I'm going to lead you to here is two things that come to mind. One is the kind of TB12 Tom Brady method of pliability, where, he had an ACL tear early in his career. He had a lineman come down on his knee. And so a lot of what I think his training or the philosophy that's grown immensely, and obviously his popularity has helped that above the actual pureness of the method. But the basic concept of pliability is like, look, if my elbow needs to be able to, go into and the camera's backwards if you haven't noticed, but if my elbow needs to be able to go into a full extension, how do I train that in weird angles, in these things that happen in sport? The other theory there is, or if you're familiar with Joel Seedman on Instagram, I know you do a lot on Instagram. So Joel Seedman has some pretty, let's call them controversial, sure. He talks about 90-degree angles. He says this is evidence-based. I'm not sure that that's fully supported, that 90 degrees is the absolute best thing. But he does have a lot of NFL athletes. I know Taylor Heineke from the Washington football team is a recent one he used to highlight of, hey, we trained in these weird angles that, again, you don't see. And that's one of the reasons he's become so popular, because it's weird looking training that you don't like. He has a barbell with one plate loaded, not like the weirdest thing he's ever put out there. But so the question then becomes, OCS, for those not familiar, is a pretty intensive exam that displays somebody with those letters behind their name. They know a lot about the evidence, the kind of conventional thinking around how to treat orthopedic injuries, right? So I guess I'm asking to boil it all down to an actual question. So thank you for bearing with me if you guys made it here on this, is how do you feel about the conventional kind of method of let's strength train, there's sport specific drills we can do, versus these kind of slightly more like, let's do some crazy shit that doesn't necessarily have evidence behind it, but the theory of pliability or training in weird angles might make us less or more resilient, more durable in this sport that has a lot of weird things and injuries happen in these weird angles. So I guess if that makes sense as a question, what do you think between those two?
I kind of like both, because if you look at the evidence, there's a pretty common study that looked at, I think it was like a meta-analysis where it looked at strength training, stretching, and balance, and which one reduced overuse injuries the most. Strength training was by far the most. Balance, I think there was a little bit, and stretching had no effect. But then we want to kind of boil it down. If you can think about it. So strength is the ability to absorb stress or load. Injuries happen when your load capacity is exceeded, right? So it kind of makes sense. If you can absorb the load, you should make sure that you're not going to be hurt. The problem I have with stretching is you have to think that a lot of people just do arbitrary stretches. So it's very common to go to a gym and people oh, you should stretch after you work out. And you see them stretching your hamstrings. It's but there's other parts of their body that they could.
This is my favorite. This is my favorite runner stretch right here.
Yeah, it's why are you stretching your shoulder if you're a runner? It doesn't make any sense, right? So, I think that's the problem.
It does feel good. I got to say right now.
I don't feel like you could generalize stretching. You know what I mean? So I think that's a problem. So I kind of would think of in your sport, do you have the movement requirements to do all of the positions that you need, right? So there might be some sports where you don't really need to be able to move in a variety of different ways. Something like Brazilian Jiu-Jitsu, if you're a Brazilian Jiu-Jitsu athlete, you need an abnormal amount of hip mobility. It's just you need to do crazy stuff with your hips. So that's just what it is. So if you don't have the movement requirement for your sport, what's going to happen? So now you're pretty much trying to force position that you don't have. And what I would say is that likely is going to lead with compensation somewhere else. I mean, it's very common in jiu-jitsu. There's a position called a rubber guard where essentially what you do is you bring your hip up all the way and you're holding your own foot. And it's a way that you can hold someone's break their posture. If someone doesn't have the hip mobility for that, it's very common for people to hurt their own knee, because if the hip doesn't move, well, the movement's going to come somewhere, and then it comes from the knee, and that's when you get those LCL, ACL injuries, So I think it is important to have the mobility for whatever you're going to do. And then one of the training systems that I like that I find successful is functional range systems. So this is probably similar to what you're talking about with pliability, where I will actually train these weird angles. I mean, jiu-jitsu is something where literally the intention of jiu-jitsu is to take a limb where it's not supposed to go, right? So I'm someone where I probably should be able to be resilient in some of those weird angles when someone's trying to break my shoulder. I got to make sure, one, it can get there, and then two, when it is there, do I have the resilience to maintain, right? Because if you can't move somewhere, that means that you're already relying on the passive structures, right? But if you can start to get into that range, then you can start doing this end range strength training. You're going to start to build a little bit more resilience in the quality of the tissue, so it can then absorb the load of the force of the joint lock or submission. So I do think that is valuable. But again, but this end range strength training is still strength training. I mean, I'm still doing high effort force at just a different angle, right? Because if you take a joint, most people, their strength training is mid-range, right? So you're not really kind of working in those end ranges, which, a lot of times some of the problems either can happen at the mid-range or potentially as your body's trying to absorb a force, like a hamstring injury is usually an eccentric load where the hamstring is eccentrically loading. It doesn't have the force ability to absorb that, and then it kind of goes, right? So we can kind of, in addition to do end range training, we can do eccentric training to start to train the connective tissue architecture to absorb said force.
Yeah, man. Love that. And again, for any of my clients that I work with are listening, that's why we do a lot of those controlled articular rotations, which is part of that functional range systems you were talking about. I definitely work that in to a lot of my folks, whether they're training for a specific sport or not. I'm a huge fan of, again, general health. And I do think that working through a full range of motion is definitely one of the biggest things. And if you're missing anything, I think that's also, really, again, for those listening, super over the top simplification of why we develop knee arthritis or hip arthritis is because we're not moving it through a full range of motion. So you get rust. So, it's again, I was in the CrossFit space and Reebok was very big in there. One of their little catchphrases was, if you rest, you rust. But at the end of the day too, I just want to bring it back to, that full range of motion. So I love that. I forgot. I seen your stuff talking about doing, FRC. I actually recently had an injury on my ring finger here, or the finger I have my ring on, which is actually my middle finger. And I'm putting it on there because it's creating a little bit of compression for now. So, but I like that, I even saw you had the, different components of, so stuff like that where again, as a general athlete, like it's hard to keep up with every joint of your body, right? And so that's the thing where coming up with a system, having an assessment, having a coach guide you through, or a physical therapist, whatever we want to use those terms, labels, to guide you through what you need to focus on that's going to serve you the best. And again, like I have a friend who I met him in Dubai. He does CrossFit and Brazilian Jiu-Jitsu. So he would call me every week with some new injury in his wrist, in his, in his forearm. He now has tennis elbow, whatever it is. And again, because the demands are so intense and he's not doing any kind of supplemental training to balance out or create the capacity. So I want to repeat that concept for those listening again, is your capacity of every joint is really what we're trying to measure. So here's my question back to you before we even define that is there a way, is there a system, do you measure capacity, or are you just working towards, kind of end field if you're working with somebody one-on-one? Do you have a way? Yeah, go ahead.
Yeah, so I would say that the capacity, and some of it is, you can look at literature, some of it is obviously based on the sport, is you can, let's say you take a joint, right? So first we can look at linear motion, right? Do they have as much shoulder flexion as they need for whatever their sport, right? What, and then one, you could look at what is the average range of motion of a human. And it's, I don't know, like you should have about 170 degrees of shoulder flexion, right? But then who would benefit more, who doesn't? Like if you're like an Olympic weightlifter and you're doing like Olympic level snatches, like you probably need more than that, right? Because you're doing an extreme amount of weight overhead. If you don't have good, like someone asked me, like, is overhead, is like military press, strict press, like a bad exercise? Well, it's like, I just think that a lot of people shouldn't be doing it because they don't have the shoulder motion to do it correctly. And if the shoulder doesn't move as much, what's going to happen is now you're going to get your thoracic extension. So now you're going to arch forward and you're in position, but you're really not in position because you're compensating. So essentially you can take a joint, you can essentially do like a linear motion, like as a physiotherapist. Does it have the flexion it needs? Does it have the rotation it needs? But then you can also look at like a controller articular rotation is also an assessment, right? Because what that's really measuring is the transition from the different positions. So you take the shoulder as it's going through. Do you have the shoulder external rotation? Do you have the flexion? Can you internally rotate, right? Without compensation. So if you can't if you're compensating, essentially that's your body's way of saying it can't do it because it has to cheat. Some of it could be like a learned thing, right? So then we can see how much of it is like a passive limitation, how much of it is like just, again, they don't know how to do the movement. So assess, does the joint do what it's supposed to? Can you control yourself? Again, do you have like a 1-to-1 active passive ratio? So if like this is common with a lot of yoga people, like they're very, very, very flexible, but they don't have good control of their end ranges. Like that's also a problem. So like those are the people that would be in the more like instability category. So like if you look at a lot of like the circus athletes, like they have freakish range of motion, but they can control the freakish range of motion. So is it true laxity or is it not? I would say laxity is uncontrolled motion.
Mm-hmm. Yeah. I like you touched on a lot of very interesting topics and concepts. I'm trying not to go down every rabbit hole there because I love each one of those. But that difference between. So maybe we'll highlight for again those listening. You might get something out of that difference. How I've heard this kind of exemplified before is the difference between mobility and flexibility. Now, do you define those two kind of again within your own context? It's a little bit of what you're talking about.
Yeah. So short answer, yes. Long answer, I was reading someone where I guess they were saying that mobility. So what you're saying is flexibility is passive range of motion, mobility is active. Apparently in the scientific literature, mobility is not that. So like they'd almost define it as like passive flexibility and active flexibility. It just, so short answer, like I agree with you. It's just, there's like people who are just as nerdy as me that are saying that that's just the wrong terminology.
Right.
But yeah, I mean, we want to have good passive motion, but then you also need the same active motion because just having more range of motion you can't control like is not necessarily good.
Yeah, and I mean this is a great example of I'm doing another podcast, not this Bono stuff one, another one called the Demand Better podcast, and one of my next episodes with my friend David Corona there in New York is demanding better from research. And this is a great example of, research is tough, and I want to give everyone the benefit of the doubt, and everyone's trying to do the best they can, but then they get into this minutia of flexibility versus mobility, and mobility also is a term that indicates like how well you can move around, right? So all these little things, and so it becomes this academic free for all, where then it when it translates back to headlines or the consumer, it's like, well, what does this mean for me? And I think oftentimes we overcomplicate some of these topics and concepts. But I think that it's good that, we have conversations like this, long form conversations that hopefully then help the listener understand, oh, okay, like that makes more sense from what my physical therapist was trying to say. And sometimes they overcomplicate it. So I appreciate you on that journey with me. Do you have any thoughts on maybe that topic of where can the research field become more efficient without going too far? Again, there's so many different places that can go. We're going to do a full hour-long episode on that alone, but would love any kind of thoughts that spring to mind with that question.
Yeah, research is tough, right? Because the better research, you need like a control group, and then you need what you're actually. So like in the physiotherapy world, like a common thing is like, well, is manual therapy effective? And it's like, at what? But I feel like some of these terms aren't really defined well, because it's like,
how do you even define manual therapy? You go down that path.
because look at the different manual. There's so many different types, and then it's like, well, you could compare like cupping to grasp and to hands-on. It's like, I feel like people are asking the wrong questions. It's like, so you take something like manual therapy. Again, this is going down another tangent, but it's like, I feel like that's not defined well, and then the outcomes are not defined well. So when someone does manual therapy, like, what is the outcome, right? Because is pain a good outcome measure? Because pain is more of like a neurophysiological response. It's like, usually as a physiotherapist, I'm focusing on function, right? We want to get the range of motion better. We want to get the strength better. And usually pain resolves. But like, if you just treat pain, like you're just going to do like ultrasound, eSIM, and like, they're not going to get anywhere. You just temporarily reduce it. So like, is that what we're doing with manual therapy, or does it have a way to have more long-lasting effects? Or how can we have long-lasting effects? Because like people like, oh, well, cupping is good. Well, how does cupping work? Well, it increases blood flow. But like, so doesn't like a warm-up increase blood flow? Like, so is a warm-up just as good as cupping, right? Like, I just feel that for research, there has to be better defined terms on what we're trying to achieve. So we actually can, because like, there'll be some study, and then it'll be like, manual therapy doesn't work. Well, it's like, okay, that's like kind of like a big jump.
Yeah.
It might be right in some level, but it's like, I just feel that things just need to be defined just a teeny bit better, not necessarily be too complicated, but to kind of like, you need a better idea of what you're trying to achieve for then to decide if something's effective. Like, so we can take an example, like you take CBD oil, like CBD oil, like cures everything apparently, and research doesn't support it. But I think the problem is like, the goals aren't defined. Like, if you think about it, people say CBD helps with pain, sleep, anxiety. And it's like, there's like way too many things for it to, so I just feel that. And then because of that, they use CBD for recovery. Well, it's like, well, what is recovery? Like, what, so like I said, I think it's better if
what my Whoop tells me. They give me my recovery. So along the lines, the other thing I want to point out, and we're going to talk about it on, again, dive a little deeper on that Demand Better show, not to keep plugging that, but, I'll use a similar example. The CBD is BFR, which is blood flow restriction training. And again, when my skeptical New York City cynicism, whatever you want to call it, from Brooklyn and all that, is that the majority of those studies are funded by companies that benefit from those studies showing a positive outcome. So it's not, Mike, who might not have any financial interest in blood flow restriction and couldn't care either way if it works. And maybe he just cares about improving outcomes for his patients, and that's going to be being able to stay in the sport longer, right? Maybe that's the outcome. And again, in order to, he's not going to go out of his way to go through an IRB, all these steps that are necessary for research, unless he has a financial interest.
Right.
And so when we see BFR is equivalent to deadlifting for your posterior chain or whatever the report is, I would be very skeptical of those things, just because, again, I bet that the only people doing research are people who have an interest in BFR, and they also probably aren't telling you. They're either manipulating the data or they're just straight up avoiding like telling any negative outcomes or whatever. And that stuff happens, unfortunately. And again, that's a whole nother thing, and I'm not calling out any one specific individual or anything that. But yeah, research is that. I just want to reinforce to those listening that research, and it's something I've covered on with a lot of different guests on here, especially anytime we're jumping around physical therapy, is research is hard. It's freaking tough. So along those lines, I want to come back to, for that combat athlete. Can you share a little bit of your assessment process? Because, I'm a big fan of every human being should have some, like you mentioned, the car mechanic should have some checkup, and to be able to, good clinician should be able to say, hey, there's a few things here, like your brake pads are getting a little low, your tires are starting to wear down. Why don't we change X, Y, Z? So do you have an assessment you can share, especially for the combat athlete that, again, FRC, like you mentioned, the functional range conditioning or systems has its own kind of built-in assessment. Looking at that movement, you can say, oh, you're missing internal rotation. You're missing 10 degrees here. And that's something that you deem important. So I'd love to hear kind of your synthesis on assessment overall.
So I guess it would start with someone comes to me because they can't do something, right? Like if you're feeling good, you're probably not coming to me. I might see them on the mat and I can see that they can't really move. There's a few movements that I think are pretty critical for the combat athlete. So be able to kneel is important, because in jiu-jitsu, it's all groundwork. Like, you kneel a lot. So if you can't kneel, there should be a reason why. And if you have an injury and it's not letting you kneel, and someone's trying to do something, like they're trying to off balance you, sweep you, and now you're pushed into a range you don't have, obviously that's problematic. So I think kneeling is important. I think for the combat athlete, a deep squat is important for the same reason. We're low because we're doing a lot of stuff on the ground, or we're on the ground and we're getting up. So a lot of like a deep squat can look very similar to like a wrestling position called a shot. So we can look at that. Something called a bridge. So again, people use the bridging as an exercise, but in jiu-jitsu, you can use that as like an off-balance technique. It's called an upa. So again, can you do that? Are you not able to do it? Why can't you do it? Other things that we could look at would be like single arm stability. Like, can you support yourself in like a one-arm push-up? Just because if you're in a position where you're on the ground, this is a little bit more common in wrestling, but if like you're in that position and someone's literally on top of you trying to drag you to the ground, but you just had a shoulder injury, can you support yourself there? Or because if you can't support your own body weight, you're definitely not going to be able to support somebody else. So those are some of the movements that I'm looking at, is like, can you do it, or if you can't? And then from there, that's when I would do like a more local joint assessment. A lot of times what I'll do for like my kind of broader compound motion is I might throw in some SFMA, or the selective movement assessment, like things like, can you bring your chin to your chest? Can you look up all the way? Can you touch your shoulder blade? Like that sort of thing. And that just kind of gives me like a little quick assessment of like if something's problematic versus let me get them on the table and actually check their shoulder,
Yeah, I'm a big fan of the SFMA that you just mentioned. I pretty much use that on every human I get the chance to assess. But yeah, do you go, just curious again, do you actually measure any kind of capacity, especially with that OCS? I wonder, I know I've played in that space as well a little bit, and they talk about some different concepts, maybe again with return to sport type concepts, which is what we touch base on again around the ACL reconstruction. In terms of measuring for sports performance, there's specific tests, maybe like for ACL, there's the triple hop or the crossover kind of jump. So other than you mentioned, you threw out a few of these of sports specific. Go ahead.
Yeah, I use those. Like, I guess I could use them as the assessment for me. That's more of like the return to sport. So we'll you already said ACL, so we'll go to lower extremity. So like some of the things we'll look at will be like your single leg squat. Like, can you do it or can you not? What's the quality? Do you cave into knee valgus? Can you do like a single jump? What does it look like? And essentially what you're trying to look for is symmetry between legs, because in most part, the concept is that you probably had pretty close symmetry between limbs. So if you're just coming back from an injury, we can kind of compare, how does your right look to your left, right? I mean, it does happen where people did have asymmetries. Like, I'm a perfect example. Like, I had a knee surgery as a kid. I had a lateral release they don't really do that surgery anymore because the outcomes weren't great. So I still have a lot of quad weakness and atrophy. So like if you test me, like I'm not going to have symmetry. So if you were like, if I'm going to have knee surgery and I want to see, am I ready? Well, I can't compare it to my right leg because my right leg is like a strong athletic leg and my left leg is the weak arthritic leg. Like there won't be symmetry. But for the most part, we're assuming that there's pretty close symmetry. So we can use those for the lower or for the upper extremity. Some of the tests I'll use would be like a push-up because again, there's some comparative norms where we can look at age. Again, someone might not be that strong, but if like you can only do 5 push-ups and the average person your age has a range of like 12 to 20, that's a problem. Another one that I'll use is the upper extremity closed kinetic chain stability test. So essentially you're in like a wide push-up and you tap. I could do the Y balance. I do that for the lower and the upper. Again, essentially what I'm looking for is symmetry between sides where Y balance is looking at proprioception or single arm stability. The upper extremity closed kinetic chain test is looking at like stability, but also because there's a speed component, so there's a little bit more power. There was some other tests that I was like trying to think about, but they're actually pretty challenging. Like there's this one, it's like a single arm step up test. So you do kind of like a single arm push up and you have to like push yourself up onto a step. I guess there was some evidence that it was good. They looked at it for like football players. But like, it's freaking hard. Like a lot of people probably can't do that. But those are some tests that I'll look at. I usually use them more at the end of rehab. But again, they can easily be used before rehab just to see like where you at. Like, again, are you symmetrical or you're not? Is this something that we have to pay more attention to?
Awesome, man. Yeah, that's some great stuff. Again, that's for those not, again, as familiar. I like diving into that because there's no one answer. Basically, even when it comes to return to sport, there might be experts in, like you said, combat sports are relatively on the newer side, so they may not have as much evidence behind it. But for like return to soccer, there's a battery of tests that are relatively agreed upon, but still not fully agreed upon. Same thing of what's a good way to prevent that we were talking about. Are there things we can look at to say, hey, X and Y and Z are a little off? Like we should really address that. I think even with blood work, we would think that when we go to the doctor and, hey, your HDL is a little off, your LDL's here, like, that stuff is still so far from finalized, I think. And there's so many different areas where it's just constantly changing and evolving and it's hard to keep up with everything. And again, as a consumer, bringing it back to that is what should they be looking out for? So again, I think my takeaway, if we can sum it up sort of, is someone like Mike here who can speak to the specific demands of a very specific sport, definitely seems to have that knowledge. So that's something to look out for where, again, if you're with a physical therapist and they don't understand this terminology, like if I had to deal with an MMA athlete, I don't know that, I can give my advice, I can give basic stuff, but I don't know the demands of the sport because I did karate, Shotokan Karate Do as a freaking junior high school kid. And I was like a month away from being a black belt, whatever that, I don't know why an 11-year-old is going to be a black belt, but, other than for money purposes. But yeah, past that, I think that looking as a consumer for somebody with those letters OCS behind the name, that's definitely a great resume builder. And also, just that's clearly specialty. You can go on Mike's Instagram, Dr. Kickass. There's an underscore in there, I think, Dr. underscore Kickass. And you can see clearly he's posting and sharing a wealth of knowledge specifically around that mixed martial art combat sport type of situation. So another question I guess I'll throw at you, kind of finishing that wrap up, is in the physical therapy space with the OCS and everything. What do you think needs to happen in our little profession here to kind of, some of the issues I think we all agree upon that we're seeing? Are you in a cash-based model? You mentioned, a lot of these athletes don't have insurance.
It's mixed. It's mixed.
Okay. Hybrid model. And again, the guy that connected us, Frank Benedetto, he talks a lot about that kind of stuff. So I guess the question is, are there specific things based on your experience in this profession that you think, is there like a top thing? You're running for president of the American Physical Therapy Association. What would your number one change that you think you'd want to implement would be?
I mean, I don't. It's hard to say. I kind of think that the way that physical therapy is going to start to go is I think it's going to become much more of a cash model. I mean, in the last few years, I just think that's been exploding. I just feel that a lot of insurance companies just really limit what people can do. And I think it's going to get to the point where reimbursements can be so bad, you're going to start seeing so many people, the quality of care is going to go down. That if you are going to be like, an athlete, or really anybody, that like if you want to get the care that you want, you're just going to have to go that cash route, So I think that's what I think is going to start to happen. I think that the problem with physical therapy is how it's being branded, because for the most part, for the last, I don't know, 50 years, people in physical therapy, they go to their primary care, they get a script for, and then they're using insurance. So a lot of people are associating physical therapy with like $20 or $30 copay. And it's like, well, that's not what we do. Right. And I think that's what people think. So if you're in like a cash model, it's like, well, you want to pay more than, I can't afford a $30 copay. It's like, what do you think we're doing? Right. You're like, you go see your primary care. Their job really is to get you to someone who can help, but a lot of times people associate a physical therapist with the primary care. We're like, oh, I'm going to go see the PT, but he's not going to do anything. It's like, I think that from a cash model, like the way things are going to go is you're going to have more time. You're going to really help people get to where they want to go.
Right.
So it's more of like a service than like it's like, this is what you want. I will pay the provider to get me back to that. Like people want to get back to jiu-jitsu. Like my job is to get you back to jiu-jitsu versus if you look at the insurance model, like, well, they don't care about jiu-jitsu. Like they just want you to have like less pain when you go upstairs. So once you're doing that, like you're done. Well, I mean, yes, in some sense, I can see why they wouldn't want to cover that. So I think that the APTA needs to do a better job of like telling people what real physical therapy is, so that it's not, people don't associate it with some like bullshit $30 copay.
Yeah, the analogy I love for all that is, people always tell me, because I'm 100% cash based, is, oh, I've tried physical therapy, it didn't work. And I'm like, that's like saying you tried McDonald's and like all restaurants are bad. And I think that analogy is really apt. Of McDonald's is that insurance model. It's a cookie cutter approach more often than not. You can order some different things, but at the end of the day, it's the difference between McDonald's and having a personal chef for an hour say like, hey, what are your dietary needs? Like, I'm going to sit here and I'm going to cook up whatever you want. Oh, you don't like the cumin, in this, like, let's change that. And they're working with you for that hour. You're paying for that time, and you're not just paying for that time, but you're paying for again, I always say, I've spent at least $500,000 on my education over the years, just between physical therapy school, continuing education, certifications, all these different things. So even the OCS exam, just to sit for that exam is $1,000, just for anyone wondering. It's no joke, on top of probably study materials and things like that you need. So again, applause for having those letters and maintaining that. Because I know a lot of people also will, I don't know if you're up on your 10-year renewal, but a lot of people I know you're not going to do it.
That's I don't know. I mean, I'm doing the paperwork so I can renew it. I did it 3 years ago.
It's every 10 years though, right?
It's every 10, yeah. But like they have this thing now where you can, like, as opposed to wait till 10, you can do like small little increments. So it's like easier by the 10 year. I'm kind of torn on the OCS. Like, it's cool. Like, you as a physiotherapist, that it's hard.
Right.
I've had 0 patients come to me because most patients come to me because I'm a black belt in jiu-jitsu and they know they want to get, like, I could be a terrible physical therapist. Like, oh, you do jiu-jitsu, I'm going to come see you. Like, I like to think I'm not a terrible PT. Like, I think I'm pretty good. Like, nobody gives a shit about the OCS.
Yeah. Unfortunately, and that's another failure of the APTA. We'll sit here and be critical, and it is a tough thing to do. I'm not gonna take that away. I'll throw out that criticism though. I don't know if you saw I think it was last year or right before COVID, maybe. They had a big old ad in Times Square, and this is where those dues dollars were going, and it was again kind of showing that working with somebody in a wheelchair and somebody in parallel bars and again, like, that's great, but that's not showing the breadth of, you know, someone like you, someone like me, what we do, and just how that's very different than and also differentiating us from personal trainers or things like that. So anyway, yeah, man, I think we covered a lot. We bashed enough different people and professions, and I appreciate your time. I want to be respectful of it. So we'll wrap it up by asking, where can folks find you if they want to either work with you, get some great information on especially around those combat sports?
So sure. So my Instagram is the word Dr._Kickass. I have a website, which is www.drkickass.com. I'm also on Facebook. So those are the best ways to reach out to me. Can I plug products? Is that cool?
Do it, man. Yeah.
Yeah. So I have some digital products. I have a kin stretch for jiu-jitsu. So we talked about FRC. If you're someone who you're having trouble with your body, it's a joint health, joint mobility, joint strengthening program specifically for jiu-jitsu. I currently have lower body, upper body. I'm going to start working on spine. I'm also going to start working on a product specifically for the physical therapist who doesn't know anything about the combat athlete. So it's something, whether you're a physiotherapist or you're an athlete who's working with a PT who doesn't know what they're doing, it's a way to kind of like talk about some of the stuff that we did, but in like a digital form. So I go over some like sports specific stuff that I think is important. I'm going to talk about return to sport criteria. And then this way, if you're an athlete and you're like, I need to get back to this, the PT doesn't know what it is, be like, okay, well, this is exactly what I want to do. And kind of, it'd be a way that the PT can work with the athlete, even if they don't necessarily know the martial art or the combat, you know.
Yeah, awesome, man. Yeah, I wish you the best of luck with all those products, and I know how crowded of a marketplace some of that stuff can be. So, again, yeah, happy to share that. And there's definitely a lot of athletes out there who can benefit from a really easy peasy, high level of knowledge that they probably don't have access to wherever they are. So, awesome. Thank you again so much for your time. We will wrap it up on that. And again, guys, reach out to this guy. Hope this whole conversation helped you get at least 1% better today. And check us out next week. We'll have a bunch more fun guests. If you have recommendations, thoughts, comments on who you want to see in 2022, we're recording this right before the new year. So feel free to reach out to me. I'm sure there's something somewhere where you're looking and reading and listening to this. All right, we'll wrap it up there. Have an awesome day. Thank you again.